Hello, ESWT Hub, Paul Hober here again. Look, a week or so ago, I gave you the task of coming up with the next round of content. So, we have some questions coming up. We're going to give a video for each question. Some of you put several components to your questions, so we're going to do a video for each one of those. They keep short, as is the ESWT Hub way. So, Alan Pybee, you asked a question about ankylosing spondylitis and the way we might treat this. So first of all, caveat everyone, very little, if any, research has been done in this area. So what you're getting here is just my interpretation of what we know about the disease, what we know about Shockwave, and how the two might link in, okay? So let's think about this just for a second. So ankylosing spondylitis is almost kind of part of the osteoarthritic type inflammatory conditions that happens in the spine. Typically, AS patients have been told to do regular exercise over and over again, try and keep themselves mobile, because it's real stiffening of the spine. So what therefore could Shockwave do? Well, we know that Shockwave has got a really good role in things like spasticity from stroke or from cerebral palsy. So we know it can, in some part at least, release some of the tension in the muscle tissue around there. So this doesn't detract from the person's need to do daily, and I mean daily exercises. But if you were to do some radial pressure wave or EPAT down either side of the spine, I think that would be really good. Also, you know, the spine actors, do we have a spine actor close by? No. They're in the box just over here, but it'll spoil the video. So the spine actor and the periactor, you could actually use that on the muscle tissue to release tension as well. I also believe that in the lumbar spine, you could use focus Shockwave on there. So to what sort of level? Look, I would be using something around the 14 to 16 hertz on the radial device. I'd be using the standard head, so the R15 or R040, depending on where you get that from. And that would be going up and down the length of the spine. So if we were to look at, you know, the sort of banknote distribution that you would normally treat your 2,000 shocks, you might be looking to do something between, you know, 5,000 to 6,000 shocks to go the length of the spine. So I think that it's going to be, you know, a fairly lengthy treatment with that radial device. And afterwards, you know, you can do your forward flexion, you can do your hyperextension, side flexion kind of gauge before you do that treatment, and then do the treatment, and then just get a little acute gauge. Next time when they come in, maybe 4 to 5 days later, you could get another gauge of their range of movement. Have they maintained any of their increased movement that they might have got after treatment since the last time you saw them? And you could start to gauge how long it would take for that reduction back to norm. So you would know that your treatment interval might then be every 2 weeks, might be every 3 days. So there's some great studies done on massage and stretching, which actually looked at the reduction in strength you got from having, you know, massage or stretching, and that all sort of blew up. You know, don't static stretch before exercise. And there have been some studies that showed that actually that reduction in strength is ameliorated quite quickly. Just doing a standardized warm-up and you'll get the athlete's strength back. So my concern, therefore, with some of the research I've done, was if we actually reduced spasticity of any kind, or tension in the muscle using Shockwave, then would it just go back to normal after exercise? Well, some of the studies on spasticity have found the effects to be weeks and even months down the line. So I can't tell you how frequently you need to do these treatments, but I do believe it would have a positive effect on ankylosing spondylitis. Part of your question said that you've got an MP100 from Storz, you've also got a PEMF device. The only stuff I know about the PEMF device is, you know, I have heard that it's significantly underpowered compared to some other devices on the market. But if we're talking about electromagnetic therapy, EMTT, maybe you've got one of those from Storz, I believe it reduces inflammation, reduces pain. So it would have some benefit for that, I think that the radial device over the whole spine would be my treatment of choice. Like I said, you know, probably north of 6,000 shocks in a single treatment, and that treatment gap would be something you'd have to figure out on a patient by patient basis. Hopefully that helps, and I'm going to do the next video right now, so keep them peeled.